listening to the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and we are winding down the month of June with some updates from the recently released ACA final rule. Before we dig into those takeaways, I've got some field notes to go over at number 5. Last week, the Federal Open Market Committee held a rate-setting meeting. Chair Jerome Powell announced the decision to hold interest rates steady. They've been sitting between 4.25 and 4.5% since the last decrease in December 2024. Also last week, interesting new legislation from House and Senate Democrats, Medicare Part E, which would be for everyone, those over and under the age of 65. Medicare Part E would compete with private insurance and is essentially formal proposed legislation on Medicare for everyone. Haven't quite wrapped my head around all the details on that proposal just yet, but I wanted to make sure I mentioned that here because we have mentioned similar efforts in the past. On Monday this week, both AHIP and NABIP released their 2026 certifications, which means that it is officially certification season for everyone who celebrates. Also, on Monday, HHS Secretary Kennedy and CMS Admin Oz announced their plan to improve the prior authorization system at a roundtable discussion attended by several top insurance carriers. Participants pledged to standardize the electronic submission process and decrease the amount of medical services requiring prior authorization. For more info, we will be linking to that release from CMS in our episode notes. That brings us to the 2025 ACA Marketplace Integrity and Affordability Final Rule, and there is quite a bit to cover here. In their brief description of the rule, CMS states that it, quote, cracks down on improper ACA enrollments, protects patient and taxpayer dollars, and restores marketplace integrity, end quote. This is one of the more interesting final rules, at least in my recent memory, because despite that overarching theme provided by CMS, we're touching on quite a few different topics of note. And then to really add to the fun, there are also different timeframes when the rules go into effect. For the purposes of this episode, that is how I've chosen to break out this information, by time frame. So we'll start with what agents need to know about immediately, and then move farther out in time as we go. And I think as we talk through the information, it'll make sense why I've chosen to do it in that way. But if not, feel free to email me and let me know. Always love to hear your feedback. Coming in at number 4, let's talk about the first time frame, which is also likely the reason CMS labeled this rule with the year 2025 rather than 2026. The first change goes into effect 60 days after final rule enactment. That language was later clarified when the final rule was published in the Federal Register on June 25th, listing the effective date of this particular change as August 25th, 2025. And that change is the removal of the monthly special enrollment period for advanced premium tax credit eligibles with an annual household income at or below 150% of the federal poverty level. According to CMS, this particular special enrollment period, or SEP for short, quote, has been exploited to enroll consumers or change their plans without their knowledge, end quote. So we'll be saying goodbye to this SEP. Moving on to number 3, let's talk about the stipulations added to the final rule that are temporary and set to sunset at the end of plan year 2026. These rules are designed, from my understanding, to be a little bit stricter for a short period of time to address what CMS sees as immediate issues in the ACA marketplace. For issuers, during the 2026 plan year, they may only use the net percentage-based threshold when calculating premium payments, CMS has eliminated the use of gross premium percent-based and fixed dollar premium payment thresholds. On the subject of advanced premium tax credits, or APTC as abbreviated by CMS, for the 2026 plan year, tax credits must be reconciled on a yearly basis. Previously, enrollees had 2 years to submit that information. Now they only have 1 year. If an individual does not reconcile their tax credits with the IRS, they become ineligible for the tax credit. Reporting that information on federal taxes has just become very important. In addition to the reconciliation changes, some changes to how income verification is handled. Marketplaces will generate an income inconsistency report when an enrollee projects that their annual household income qualifies them for a subsidy, but IRS income data reports an income level that's less than 100% of the federal poverty level. Another change to income verification. When projected household income can't be cross-checked with the IRS via tax data, marketplaces can no longer accept self-attestation from an applicant or enrollee. The exchanges must verify income with, quote, other trusted data sources, end quote, in order for that individual to qualify for the APTC. Let's talk about auto re-enrollment. This was a stipulation we mentioned in our coverage of the proposed rule. When a marketplace beneficiary is automatically re-enrolled into coverage that after the APTC is applied results in a $0 premium charge, a $5 premium payment will be applied. The idea with this rule is to keep enrollee information as updated as possible, double-checking that individuals are still in a plan that works for their needs and that they're still eligible for their tax credits. Essentially, they're paying a $5 premium penalty for not updating their information. But the good news is, when they update their information, the $5 penalty will be removed. And then when tax time rolls around and they reconcile their APTC, they should get the money back that they overpaid. The automatic re-enrollment premium penalty only applies to coverage obtained on the federal marketplace platforms, not for the state exchanges. This rule and a few others we'll get into are a little complicated to carry out at the state level. And again, the goal of these rules is to really eradicate those fraudulent enrollments and plan changes that were more prevalent on the federal level rather than at the state level. And then our last, specific to the 2026 plan year specifications. Let's talk marketplace eligibility verification for special enrollment periods. Federal marketplaces are being asked by CMS to, quote, conduct pre-enrollment verification for SEP eligibility, end quote. This rule does not apply to state marketplaces, and by the language of the rule, will sunset at the end of 2026. Also related, CMS is setting a threshold of 75% pre-enrollment eligibility verification on new federal marketplace enrollments. This adds a metric for CMS to track utilization of special enrollment periods on new enrollments. And again, CMS has said about the marketplace SEP utilization, quote, has been exploited to enroll consumers or change their plans without their knowledge, end quote. Both pre-enrollment verification for SEP eligibility and the 75% threshold will sunset at the end of 2026. This is an attempt by CMS to strengthen the rules and try to really tamp down on unauthorized enrollments. Next up, at number 2 on the list, let's talk about the changes that go into effect for the 2026 plan year that are not just for this year. They are just straight changes that will continue into the 2027 plan year and beyond. First up, CMS has reverted their definition of lawfully present to exclude DACA recipients. For the 2026 plan year, they are ineligible for qualified health plan enrollment through the marketplace, premium tax credits, advanced premium tax credits, and cost-sharing reductions. At the state level, CMS also reversed the 2024 rule allowing DACA recipients to enroll in basic health programs. CMS also revoked the 60-day extension to resolve income inconsistency with the marketplace. Individuals who find themselves at the other end of those income inconsistency reports will have a 90-day window to resolve the issue, but the additional 60-day extension after that has been removed for the 2026 plan year and beyond. Next on the list, and CMS is leaving this one up to the carriers, past due premium amounts might prevent individuals from enrolling in new coverage. Insurance carriers will have the ability to require payment of both the initial premium payment and past due premium amounts in order to effectuate coverage. Again, CMS is giving carriers the ability to require collection of those past due amounts, but just because they have the ability to do so doesn't necessarily mean that the carriers will go that route. This is definitely something to bring up with your carrier reps and ask about in trainings because the precedent could change from carrier to carrier. And then on the subject of automatic re-enrollment, CMS is putting an end to auto re-enrolls for a CSR-eligible bronze QHP enrollee into a silver tier QHP if the plan is in the same product, has the same provider networks, and has a lower or equivalent net premium as the bronze plan they would have stayed in. With the current administration looking to streamline efficiency and cut waste, the move does make sense because silver level plans are the only plans able to have cost-sharing reductions applied to them. They're not saying that an individual can't be enrolled that way. They just want to route them through the proper verification channels, which, again, should help catch the unauthorized and fraudulent enrollments CMS is concerned about. They also claim it will decrease confusion, which I have to say that is a fair assessment. And then the last rule going into effect for the 2026 plan year. We talked about this a little bit in my interview with Christian Brindle over on the 7 Figures or Bust podcast. And I think we also mentioned it here on the show. CMS is changing their evidentiary standard for termination of agent, broker, and web broker marketplace agreements for cause to a preponderance of evidence standard of proof. I had to do a little research here, and I was able to find a fantastic image that illustrates the different standards of proof. This graphic presents the standards of proof pyramid style, and when you look at the pyramid from low to high, we start with reasonable suspicion and move up to probable cause. Next up in the pyramid is preponderance of evidence, followed by clear and convincing evidence, and then beyond a reasonable doubt tops the pyramid. According to the official definition, preponderance of evidence means that, quote, a fact is considered proven if it is more likely than not to be true, end quote. And to get a little more specific, burden of proof is met when, quote, there is a greater than 50% chance that the claim is true, end quote. Also, interestingly enough, most civil trials are tried using this standard of proof, which I did not know. So, preponderance of evidence is being adopted by CMS as their official, quote, standard of proof with respect to issues of fact for HHS to assess whether an agent, broker, or web broker's marketplace agreement should be terminated due to non-compliance with applicable HHS rules and the terms of their marketplace agreements, end quote. Again, I'll reiterate that CMS is actively trying to root out the bad actors in the ACA marketplace with these rules, while also giving themselves the ability to terminate those bad actors. It will be interesting to see if these measures are effective in the ways that CMS hopes. And now for the change that was pushed back to the 2027 plan year. Coming in at number 1, the new dates for open enrollment on the ACA marketplace. For the federal marketplace, open enrollment will begin on November 1st and run through December 15th. For the state marketplaces, CMS is allowing a smidge more wiggle room. OEP must start by November 1st and can only run through December 31st. Additionally, state marketplace open enrollment periods may not run for more than 9 calendar weeks. So a little bit of wiggle room, but as I said, just a smidge. And then the biggest change, all ACA open enrollment period enrollments must have an effective date of January 1. Those changes go into effect for the 2027 plan year, at least according to the final rule. That could change between now and the 2027 open enrollment period. So for the 2026 open enrollment period, dates for the state and federal marketplaces will likely look similar to what they were last year, but don't quote me on that. Some states might choose to adopt the new dates sooner rather than later. They certainly have the ability to do that, but we will definitely report back here on that should it happen. Just another reason to make sure that you are following along with our show. We do actively try to bring you all the information insurance agents need to know in these Friday 5 episodes. And with our new Field Notes series, we have the ability to add in standalone episodes during the other days of the week as news breaks. So very excited about that. And we would love it if you would follow along with the show. If you're already doing that, can I just say thank you so much for that? And if you wouldn't mind, maybe consider leaving us a review to let us know how we're doing. We love hearing your feedback. We want you to think of the show as your podcast, your survival guide to the industry. And we want to be talking about what you want to know about. You can drop us an email at asgpodcast@ritterim.com. Call our hotline at 1-717-562-7211 or reach out on social media. All of that contact info is in our episode notes, along with the links to our sources for today's episode. Thanks so much for listening. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen.